Michael Ninnmey here, and I'm Bernard Price.
And this is Walton Community TV.
That's right. Okay, Mike, nice for you to pop round. Now, there's been a couple of meetings for entirely to do with local health, isn't
Indeed,
there, recently? Yeah. And I understand that the first one you went to was at the Grove Medical Health Centre, our new medical health centre.
Indeed, I did.
Yes, right. Well, okay. If you could just really sort of let us know what's going on.
Well, we'll try to do a summary of all that's been going on, and there has been quite a lot. Basically, we had a meeting at the Grove on the 20th of February. The prime reason was to get a chairman. Which, as we all know, currently very difficult to get key officers in most organisations, isn't it? Anyway, we've been very fortunate. A gentleman called Richard Love came forward for the Grove Medical.
Is he a local man?
He's been here a little while, I think. Not quite as long in the tooth or as established as you and I, but he's been here, and he seems to be getting himself organised and getting the practice organised, and basically that was the key requirement. But the other thing that we were looking to agree and established is the Grove, like some of the other PCGs, I think, arrange particular care days where they try to get as much current information that they can get about a particular condition. So it was agreed that we would look to do asthma, I think. It was our first kick-off, and that was going to be March, possibly April. Because I've got an interest, will be doing strokes, and that's going to be on the 26th of June. And later in the year, possibly in October, we are looking to do a mental health day. So it's really conditions that are applicable and of interest to the patients within the practice. So that's really what the meeting on the 20th of February was to do. And the other thing that we discussed at some length was how can we better communicate with the 15,000 or so patients that the Grove has on its list. That's a lot of people.
Yeah, that was the point I was going to make with it.
It's a lot of people.
Patient participation group means participation, and this is an ideal way of communicating it. But
it is.
Otherwise, it's a bit of a problem, isn't it?
Well, it is but I think one of the things we did sort of discuss at some length, how do we get the information really, and this is a part of the change that's happening now, which will have significant impact on folks living on the peninsula into the future, because though this is the Grove PPG, we tend, I think, within the peninsula, share what we can, and that moved us on to the second meeting that we had.
Yeah, it's a shame really that we still haven't got an old Felixstowe Times, isn't it?
Go back to the Friday. And everybody used to buy it. Or most people did, didn't they?
Yes, the other one was at, where was that? That was
up at Walton
that's right, yes. And that was the same, a patient participation group?
Yes, it's the Felixstowe Patient Participation Group Network. Network meeting. Wonderful meetings. And I was a bit late to that, and fundamentally the agenda was a very full one, and it was primarily for the hospitals of Ipswich and Colchester to be telling us where they're heading. And I think what they presented to us, and I think you've got a copy there, Bernard, haven't you? Was the
these framing our futures.
Now I don't know whether you can pull out that front page that says picture this, framing our future, and this is draft strategy for East Suffolk and North Essex, which is now what the group running both Colchester and Ipswich Hospital is, and as no doubt our viewer is aware, the whole of the hospital situation was that Colchester was failing, Ipswich was viewed as the white knight, but perversely, because Colchester is a foundation trust, whereas Ipswich is only a trust. Colchester had to take over Ipswich. So that's where we are now. Which seems perverse, doesn't it? But
it does.
Anyway, this appeared to be their first hit at how they're looking for the two hospitals to function, providing services across East Suffolk and North Essex. That's what they're looking to do. So if we go, the philosophy of this new organisation is time matters. Well, it does to us all, doesn't it?
You have to have a mission statement.
Yeah, that's virtually.
I know if you've been to your management meetings, you have to have a mission statement.
Sadly,
that's the mission statement. It's all, by the way, it's all on another video. If you can't see this properly, there is another video on WCTV where you can see these things close up.
And the one you really, I think, to give us some indication,
that's it.
Is the next slide, which is a future model of care. And I've had discussion on this. We had discussion at the at Walton surgery, and I'm afraid, even though it's supposed to be self-explanatory, I don't really find it that. I'm afraid.
It's a diagram drawn up for people that like diagrams, isn't it? Really?
Well, it's as Bernard can show you, it's concentric circles, a bit like a dartboard. But what it's supposed to show is that care for you and yourself will be centred on the home, because or work. That could be home or work. I mean, it could be wherever.
That's
the situation occurred that caused you not to be your fit and healthy walk around self, and that could occur anywhere. You know, it could be at work. You could be travelling. And what it seems to say, as you go out in waves in these circles, is if you're at home, you've got integrated information. Apparently from the patient portal. Well, that then is already sort of restricting, because it assumes you
patient portal.
Exactly that. But what it means, doesn't it, is that you've got to have access to a computer network to get on the internet, to get to the patient portal, to get whatever.
Does that also mean phone? Was it 111?
Well, no, I don't think it does. And that's what's a little work.
There's a patient portal.
Well, you used to have, what was it? National NHS Direct, was it? You could ring them up and say, I'm feeling not well, and they could give you advice. That sort of died, didn't it? I think that sort of, they decided they wouldn't, don't go there, Bernie, because we'll be here all day. 111 is still there, because they operate the service when our doctors are taking a well-earned weekend of work or of leisure rather than work. So going on from that, you move from home to self-care and well-being. So I don't quite know what that means, to be honest.
That still means you're at home, basically.
It seems to imply that. But it does say here, and from the home, you can self-refer to diagnostic and or specialist advice. So where's that?
You phone up the GP, I would imagine.
I don't know.
Well, that's what you do.
You jump outside the integrated neighbourhood teams, and what are they?
They're not explained, are they? Really?
I think it's not particularly. It might be better to show them as the silos they seem to continue to be, don't they? I mean, it gives the idea it's a wraparound service. Well, as most of us know, if you're looking eventually to that hospital-based care, if that's what you need, you've got a journey, you've got to get there, you've got other, and this doesn't sort of cover how East Suffolk and North Essex NHS Foundation Trust is going to be addressing those issues, because they still don't appear to have done. So have a look at that. When we go over the page, it says, this is our draft strategy for the next 5 years. We will offer the best care and experience. Well, fair enough. It says 1, keep people in control of their health. 2, lead the integration of care, and that I certainly support. But we don't seem to have moved on this. We've been talking about it for probably decades, actually. I mean, when you were a chemist in Boots, you must have had, you know, the wish list of, wouldn't it be good if the GPs and third parties and charities worked together for the well-being of folks who perhaps needed a bit of a...
Well, yes, I mean, we used to be the referral arm there, but in those days it was not formalised at all.
No.
You used to get, not in Felixstowe, I hasten to add, but you used to meet in some towns professional jealousy where doctors didn't like the pharmacists interfering, if you like.
Yeah,
but,
it still happens.
But normally, I mean, in the old days, the patients used to see the doctor. Sometimes they used words they didn't understand and used to come back to the pharmacist for translation. But we were sometimes the first.
Yes.
But we now are officially the first.
You pretty much are.
Yeah.
I know it says develop our centres of excellence. Now, in that, I'm totally supportive. If that's what's being discussed here, is the hospital system of Ipswich and Colchester. And despite Colchester being in the difficulties that it became, it did have centres of excellence within it.
Yes.
I mean, one of its very highly regarded treatments was radiotherapy for cancer.
Yes.
Ipswich has a national reputation for spines.
Yes.
It also now has a much improved performance in strokes.
Yeah.
So that's what they're looking to do. And I think, in fact, I did say this, a long time ago when we had the Primary Care Trust. The only way our general hospitals are going to survive in the whole centralisation, which is a big push, is if they are excellent in a particular activity, and that's what will save them. You know, and I support that. It says support and develop our staff, and then at the bottom, number 5, it says drive technology-enabled care. Now, this is our new Minister of Health, young Hancock. That's his big thing, isn't it? The world will be so much easier and better when we're completely overlaid with brand new technology that will work perfectly first time, as it always does, doesn't it?
Well, they sometimes talk.
So yes, it's some of it. I mean, one of the big steps forward is to remove the fax machine and pagers. You know,
I'd have thought they'd have gone by now. Anyway.
Well, no, they're still there. The biggest users of pagers, 10% of the world usage is the UK NHS. Right. Over the page it talks about integration.
Yeah, again it's on our recent video we've posted, so you can have a look at these all close up.
Yeah.
Yes.
And when I look at it, it seems to be sort of a horizontal line of the concentric circles we had at the beginning. Yes. And I'm not quite sure. We go from person to INT to consultant and diagnostic to hospital-based care, and it's whatever it may be: information, access, sharing decisions, prevention, coordination to keep me or get home. So it's really a lot of this is hospital and mission adverse, which is where they're looking to go, because you really shouldn't be going to hospital unless you really need to go there. Because in some cases,
what is now, but they're actually putting it on paper.
They are,
and it's pretty common sense. I should think most people would know without being taught. They know the routine if they're not well. What the stages that
pretty much
the stages that are available. Yeah.
And over the page you've got emergency care, and that deals with integrated health and care data, self-care, integrated neighbourhood teams, urgent treatment centres, emergency departments, specialist assessment, inpatient care. So it's a sort of 6 steps that might get you admitted to hospital, and you could actually be delivered of some cure or addressing of your problem at any stage going through that. And the urgent treatment centres is something we'll come back to later, because that ties in very well with our MRU or the fact we will no longer have it. Planned care, elective care model, and over the page to that is what you could expect to hear from us over the next few months. I was a bit disappointed with this. I mean, I was amazed it said improve visitor experience, and then I saw this and retail at Colchester Hospital. Well, I go to hospital for hospital. I
Yeah.
don't go for retail.
You're
It's
gonna
not
put
retail.
WH Smiths in
Yeah,
there.
I mean it's not retail therapy, but
No.
it's come. The front of the
Yes.
hospital now is a selling opportunity, isn't it?
Yeah.
And in fact, I really sort of miss the old WRVS who used to the volunteer part of it, and now it's all sort of commercialised and
you
private.
just put your slippers on and go down to WH Smith in the foyer, isn't it? Really, that's
It's very odd.
Yeah.
Urgent treatment centres, and that's really what will be replacing MIUs. That's the new name, and they're both at Colchester Hospital, and that's opening November this year, and Ipswich Hospital, which they're working on. Plans for a specialist elective care centre and the wonderful patient portal.
What would you say plans for a specialist elective care centre?
Well, it sounds as if you can, go and choose it yourself.
Yeah.
That's what it sounds like, doesn't it? But elective surgery normally is what has been agreed between your GP, the consultant, and
when
you.
you've got a bad hip, when you can
just go along and say, can you do one?
When they can fit you in, basically, isn't it? Yeah.
I'm not sure what that is.
Or
Plans.
you can manage without. Yeah, it's one of those things which is not, you're not life threatening. It's a hip problem, or
more on that to come, I think. Anyway, at the end of it, it says, "What do you think?" So I think if you if you have a particular view, make it known.
Yeah.
So that was a presentation by those who came from East Suffolk and North Essex, whatever. And I think the
can I just say there, Michael?
Yeah.
There is a video with showing these in detail, which is you can't really see them with me holding them up. Have a look at them. Listen to what we've said. Then have a look at them, and if you've formed a strong opinion, there is a place where you can let them know what you think.
Absolutely. Now, at the end of this presentation by the hospital group, there were a number of concerns expressed by those who were representing PPGs. That was Walton, Howard House and the Grove. There wasn't any representation from Haven PPG. And it really was that we didn't really find that slide presentation as clear as we thought it could be at all.
Yeah.
Really.
When I put it on the video, it was a bit. It was being done by professionals, but for their own benefit, not for the benefit of the likes of us.
Yeah,
basically.
It needs to be crystal clear.
Yes.
It needs to be transparent, and it needs to sort of. I mean, because illness just doesn't arrive at home, does it?
Yeah, I think.
That one might have shut down.
Yeah.
Okay. We'll do a quick bit that is of much more, of equal concern, I think we could say, and that is our MIU and what will be happening with that, because we sadly were told at the meeting that the hoped for changing of names, etc., so that the facility that we've all had since '53, I think, isn't it?
Yeah.
The actual walk-in facility at our, what is now our community hospital, would be able to continue in some form.
Yeah.
Despite apparently a number of meetings, a lot of heartfelt discussion and persuasion, there appears to be a problem, and it would appear the GP Federation, who is actually managing both the Haven, Howard House and the Walton, were reluctant to be a part of such a service. And I'm not sure what the Grove situation is. I hope to get some clarity on that before coming days. But sad to tell you, dear viewer, that it will not be a walk-in service. There was a lot of discussion by the CCG representative that in view of where they got, they felt it necessary that they train more effectively those who were there representing 111 service, because out of hours they will be taking the inquiry, and equally the receptionist at the doctor's surgeries. Now, the concern I have, you've now got a gatekeeper on what was our MRU, and those gatekeepers, very well-meaning undoubtedly, but they are representing a private company effectively. It's not actually owned by the NHS. It's contracted to, and I feel that it's a block. Now, if I'm on the allotment, or my grandchild's on the seafront and cut themselves or break something, what they want is an instant place to go to. And they'll see a sign, won't they? Community hospital, and they're told to, before they can go in it, you've got to make a phone call. It will become, I think it will be, the population will really wonder how bizarre a bureaucracy is that's got us into this situation. So what they've said, as a result of the fact they've had to take a lot of time doing this, the amount of time they've had to deal with the fragility clinic that's supposed to be a part of the new service coming to us hasn't really got underway, so that will be deferred. Even this whole thing is expected to be implemented in April, but the final decision on this will be taken at the next CCG board meeting, which I understand is to be at Hadley Town Hall.
So it's not actually like an A&E. If you did cut your toe on a piece of glass, which people do, unfortunately, leave on the front sometimes.
They do.
If you cut it's not an A&E matter. You have this other layer before that.
That's what
which is also at the hospital. So it's sort of like a junior A&E and a senior A&E for if you're really ill.
Well, now this is something else you need to be aware of, dear viewer, is we talked about a slide, emergency care, and it had self-care, integrated neighbourhood and teams, but then it moved to this new term, urgent treatment centres. Now, urgent treatment centres are going to be an skilled and run MRU effectively within the hospital. Now, it struck me from what they were telling us, what will happen when you next go to a hospital for treatment, you will have a 3 entry point. One would be effectively a GP. That's what it would be. It will be a GP surgery type level of whatever. So he might prescribe and send you home on your way happily. The next will be effectively an MRU.
But it'll be a walk-in GP sort of.
Yes.
Sort of.
You'll be triaged at the front, and somebody will direct it to you. This is how it read. It's not actually active yet, and from what we read, Colchester might be going live in November, and we'll find out. But at the end of that, you would have what we now know to be A&E. You know, the emergency bit of the whole bit. Fully staffed with specialists, etc. So now I'm not sure what the MRU, the new updated, it's just getting confusing.
The minor injuries unit,
which will now be called the urgent treatment centres. This is the upgraded MRU. So you're going to have, it would appear, 3 routes to care if you were to turn up at a hospital in the future, and one would be effectively a classic GP. Next would be a minor injuries unit, and then the rest would be emergency.
So there'd be like nurse run minor MRU would be.
Well, the MRU to be an MRU. Well, the MRU updated to an urgent treatment centre has got to be doctor managed, which is why we weren't ever going to get it here. So that's pretty much, I think, where we've got to. So the next update we'll be able to give you will be following the CCG board meeting at Hadley, and I shall go and I will ask the chairman, Mark Shedden, as we asked at the end of the last one, how come we've not been able to retain work? Because I am very, very worried about the sort of continuous process of effectively privatisation of the NHS. We continually contract stuff out. We rarely contract it back to the NHS. And with the best will in the world, when we look at an awful lot of contracting out, in the services that we've been getting, whether you look at the probation service or railways or commissioning ferries or whatever. I'm afraid very often the public purse seems to be taken for a ride. Really, and that money can only be spent once. So you and I are the net losers. So we seem to be in a period where public bad, private good, regardless of how bad it is. That's bizarre.
Coming back to Felixstowe, also there is the odd puzzle which we can't answer, and that is we've got in the middle of the town we've got Felixstowe, what everyone calls Felixstowe General Hospital.
They do, which is the cottage, community hospital.
And we've got the Grove Health Centre on the outside, which are both fully equipped.
Yes, they are.
But don't.
No, well, there was a problem, still is a problem. Ipswich Hospital was paid X amount of money depending on how many people they were treated. So it was actually a volume. And it wasn't that cooperative in helping that volume to be decreased by, they thought, inefficient use of consultants coming down to Felixstowe to use the facilities we have, as you say, certainly at the Grove Medical Centre. So there, folks, what you really need to know, I suppose, is at the time a new surgery is agreed, that it is supported by the general medical services surrounding it, that they will support it. And if they're not going to support an operating theatre, you've got to question, well, why would you build one?
Right, well, on that, we'll stop.
Well, thank you very much.
Okay, thank you, Michael.
And I hope you enjoy it. And I hope Bernard can chop this into some very readable, presentable
We'll see what we can do.
Nice to see you, sir.
Okay, cheers.
Off we go.